Thank you, Amanda, for that kind introduction, and thank you so much for the welcome. I'm used to speaking extemporaneously for 3 hours at a time to people who expect an exam, so we'll see how this goes. So in preparing to give this sermon, I was reminded of the study abroad semester I spent teaching in Botswana, in southern Africa, with 21 college students enrolled in colleges of the United States. We visited an orphanage there while the children were at school. The facility was a cluster of small, identical buildings, which each contained one kitchen, one living room, and 3 bedrooms. The kitchen was the size of a closet, and the stove only had 4 burners. One bedroom was for the house mother. The second bedroom was for 6 boys and had 3 bunk beds. The third bedroom was for 6 girls, also with bunk beds. And the children had posted drawings and their school schedules on the walls, the same as any children would. We were invited to peer into their closets, where we saw 6 tiny piles of 3 pairs of pants, 6 tiny piles of 3 shirts, and that was about it. In other words, the tidy closets were mainly full of emptiness. The children, some of whom were HIV positive and some of whom were HIV negative, lived in the orphanage because there was not one living adult relative who had the resources to take them in. In Botswana, right now, at least 70% of all families currently include 1 or more orphans. Children lived in the orphanages because not only their mothers, but also their aunties, their adult cousins, had all died of AIDS. And their grandmothers were already caring for so many other relations that there was no room, no food, no money to take in just 1 more. Our donations of toys and games from the United States seemed paltry in the face of all the emptiness in the closets. And we thought about how this was just one facility, one of the nicest in all of sub-Saharan Africa, and that there were thousands more and thousands more that were needed. We knew that there are literally millions, actually more than 15 million, children orphaned by AIDS in sub-Saharan Africa. Millions of very tiny piles of shirts. An otherwise rambunctious bunch of college students was ultimately moved to silence. But it is important to move from silence into speaking out. And I'm here today in commemoration of World AIDS Day, which was first observed on December 1, 1988, 26 years ago. Let's take a moment to consider the enormity of the situation. We commemorate World AIDS Day because of the sheer numbers of those living with HIV and AIDS today, and to remember the equally enormous number of people who have already died of AIDS. According to the United Nations and to the World Health Organization, there are between 32 and 37 million people living with HIV today, of which 3.2 million are children under the age of 15. Approximately 39 million people have already died of AIDS since the 1980s. And that number corresponds to 6% of all people alive today, 6 in 100. In other words, about 6 of the people in this room right now. Most of the people living with HIV today live in sub-Saharan Africa, and most of the people who have died of AIDS also lived in sub-Saharan Africa. The gay male community in the United States continues to be heavily impacted by HIV and AIDS. Men who have sex with men account for almost 80% of new infections in the United States. And although globally the rate of new infections is falling, rates of new infections are actually rising among gay men in the United States, especially among gay men of color and young gay men. Let's think for a minute about not just the enormity of the problem in the abstract, but the people we know and love who are HIV positive, or who have AIDS, or who have died of AIDS. For while HIV and AIDS are prevalent in sub-Saharan Africa, HIV and AIDS are also here in the United States, in Colorado Springs. I want to talk today not only about HIV and AIDS, but also about what this terrible pandemic can teach us about social injustice and about integrity. I'll start with integrity, which I'm using in the sense of wholeness and connection. How ironic that a horrible infectious agent such as HIV reveals our connectedness. HIV came from West Africa when a hunter acquired the HIV virus from a chimpanzee, approximately in 1908. From there, HIV infected another person, and another, and another. Every HIV positive person is literally, physically connected to a single West African who was alive, probably living in poverty, in the early 20th century. Consider that just for a moment, because it reveals a connectedness that we don't think about very often. We often think about connectedness in terms of economics. Is there anywhere you can't buy a Coca-Cola? But we are connected much more profoundly through our very bodies to everyone else on this planet. Every HIV positive injecting drug user in Thailand, every HIV positive African American teenager in Mississippi, every HIV positive gay man in Colorado Springs, every HIV positive mother in the Bronx is physically connected in unbroken lines to each other and to that first infected person, every single one. HIV, this horrible virus, reveals the literal truth at the heart of the seventh principle of Unitarian Universalism, respect for the interdependent web of all existence of which we are a part. We humans are an integrated whole, stretching from here to 1908 and much, much farther back than that. And we are connected to non-human animals and to all other living things, the vast majority of which are microscopic. The vast majority of those microbes are actually viruses. And so we are whole. The biosphere is wholeness. And yet, my actual life is not impacted by HIV or AIDS, except that I have opted to teach about it. This is where social injustice comes into the picture. While almost everyone is susceptible to HIV infection, only some of us are likely to encounter HIV in our everyday lives. Although we are all connected, we are also all sorted into social categories, such as nationality, and within nationalities into smaller categories, such as gender, sexuality, race, and social class. Our social categories strongly impact how much injustice we will face and how hard it will be for our lives to be whole. And they impact how much risk we are at for HIV infection. This summer I attended the 20th International AIDS meeting along with thousands of doctors, scientists, and activists. While there, I learned a great deal about the pandemic, especially about the groups among whom the pandemic continues to grow. Scientists and doctors have come up with a name for these groups: key populations. The name signifies that until we stop the epidemic among key populations, we will never stop the epidemic among all people, because indeed we are all connected. The key populations of greatest concern at the most recent International AIDS meeting were, globally, sex workers, transgender and transsexual people, men who have sex with men, injecting drug users, prisoners, and in certain regions of the world, all young women and girls. In the United States, the key populations are men who have sex with men, injecting drug users, and poor, young African American women, especially those living in the South. People in key populations share a few things in common. First, they are living in a community that already has high rates of HIV infection, so that the people they are most likely to be intimately connected to are also likely to be HIV positive. Even trying hard to be vigilant, to be responsible, it is possible to make mistakes and to get exposed to HIV. Because for these communities, HIV is all around. Most of us in this room are simply fortunate that the sexually transmitted infections equally prevalent in our community, such as herpes, are not deadly. Think back to your high school and college years. Imagine a world in which every friend who caught a sexually transmitted infection caught HIV in particular. This is the world in which people in key populations live. Second, whether HIV positive or negative, people in key populations are stigmatized, negatively stereotyped in numerous ways. Part of being stigmatized is being set apart as different, as disconnected from other people. Stigmatized people are explicitly and implicitly left out of the human community. Think about the stereotypes about injecting drug users. That they are dirty and sneaky, that they lie and steal, that they are, in a word, fiends. Fiends are monsters, not humans. And yet, one of the most beautiful slideshows I saw at the AIDS meeting included images of poised Thai women dancing. Every single one of them was HIV positive, and every one of them had contracted HIV through drug use. People in key populations have to fight to be recognized as human, as dancers, as workers, as volunteers, as lovers, parents, and children. Along with stigma comes many other disadvantages, such as reduced access to decent housing, to good education, to meaningful and reasonably compensated employment, and to healthcare. All of these disadvantages have a negative impact on disposable income, which is important for being able to afford life-saving medications. Did you know that men who have sex with men earn between 10 and 30% less than their straight counterparts for exactly the same work? In some cases, they actually earn as little as we women earn relative to men. Think about that. 42% of all people in the United States live on less than $25,000 pre-tax income per year. And the best antiretroviral medication easily costs $30,000 a year. People in stigmatized groups are less likely to have health insurance than other people and are more likely to find HIV medications unaffordable. That is not justice for all. That is injustice. And as long as there is no justice, integrity of any kind will be impossible to achieve. What about sexual integrity? I originally left church and moved toward goddess worship because I have a problem with how most churches teach about human sexuality. I don't believe sexual integrity has to mean monogamy within a heterosexual marriage, or monogamy within any marriage, or even monogamy. I believe sexual integrity is about both individual choices and communities. And I know that sexual integrity is not equally accessible to everyone, and that without justice, sexual integrity can be difficult to attain. To understand what sexual integrity is, especially in the face of HIV and AIDS, we can take an urban gay male community as our model. Some men in gay communities practice permanent or serial monogamy, while others do not, and there is not necessarily a moral premium placed on monogamy. Sex is not something to be ashamed of. There is instead a premium placed on self-knowledge and on taking steps to reduce the likelihood of transmission if someone is HIV positive. But there is also no abandonment of individuals to try and stay HIV negative on their own. Rather, the San Francisco gay male community is now involved in a program called RAPID, which is an acronym that stands for Rapid Antiretroviral Program Initiative for New Diagnoses. Not a great acronym. When someone tests positive for HIV in one of the many free testing clinics, he receives a phone call that refers him directly to one of 2 hospitals that dispense anti-HIV medications at low cost, and then direct him to social services to help him figure out how to manage the $3,000 per month needed to pay for the medications. If he has no insurance, the social workers quickly get him enrolled in a program that makes the drugs free or almost free. Volunteers check in regularly to see how he is doing. This plan of action is the largest known implementation of what has been called treatment as prevention. Treatment as prevention means that someone on treatment can reduce the amount of virus in their blood to undetectable levels within 3 to 6 months of treatment. And someone with undetectable levels of virus in their blood is actually no longer infectious. There is a new drug that complements this strategy by blocking infection despite exposure. It's called Truvada, and it can be taken once a day, like birth control. It reduces a person's risk of acquiring HIV by 90%. It is particularly useful for partners in which one is HIV negative and one is positive, but it can also be used safely in conjunction with condoms by people who have multiple partners. These strategies have led the gay community in San Francisco to set a new goal, to be the first city to achieve no new infections for an entire year. Gay men have taught us that the non-negotiable fundamental characteristic of sexual integrity is the ability to have sex when and how we want to have sex, and if we want to use condoms or contraception, that we have control over these practices. Unfortunately, many people living in key populations do not have access to sexual integrity. They have unprotected sex with strangers for money and do not have the power to negotiate condom use all the time. Or they have unprotected sex with people they know intimately, but their partners dominate sexual situations and refuse to use condoms. Or they have unprotected sex because they don't have access to condoms, because there aren't any, or they're too expensive, or they can't risk getting caught purchasing condoms. Or they don't care whether they get exposed to HIV or not for any number of reasons that range from a lack of education to a lack of self-esteem, or even to the conviction that becoming HIV positive is inevitable. Or they just make a mistake. We all make mistakes. And this is where the community is valuable, because when strategies such as RAPID are in place, the consequences of making a mistake don't have to be dying young of AIDS. And here's where we can all play a role. First and foremost, we have to work against stigma and discrimination in all their forms. In order for men who have sex with men to get tested, to get treated, to use condoms and Truvada, they have to be able to be out to themselves and to their communities. And being out is still just too dangerous and too difficult in too many communities. We can't go on mischaracterizing all IV drug users as fiends or all sex workers as desperate, stupid women. We can't let sexism continue to create situations where women depend economically on sexually satisfying men who have all the power. We have to talk about integrity when we teach our kids about sex. Now, because my college students come from all over the United States, I can testify that sex education in this country is completely broken. Very few adolescents have the benefit of an Our Whole Lives curriculum. We did not plan this ahead of time. And this lack of education hurts the most disadvantaged kids the most. AIDS is the #1 cause of death for young African American women in this country. The #1 cause of death. We are falling shamefully short. That's right, say that 10 times fast. On teaching them about sex, sexuality, intimacy, birth control, HIV, and integrity. And also, we can take responsibility for educating ourselves and our community, not only about sex, but about HIV and AIDS. We should know how US policy affects the availability of anti-HIV medications in Botswana and around the world, including Mexico, I'm sure. We should wrestle with whether we think US policies related to pharmaceuticals and international aid are good policies. We need to make life-saving medications available to everyone who needs them, to have a rapid response in place for everyone in Botswana and China and Haiti and Colorado Springs. We should ask hard questions, like why antiretrovirals cost less than $1 a day in South Africa, but $3,000 per month here in Colorado Springs. Or why we can deliver Coca-Cola all over the world, but not simple medical supplies like gloves or IV fluids. We should think about the empty closets in orphanages around the world, and we should talk about how to make a difference. I invite you into these conversations here at church and beyond. HIV and AIDS continue to devastate the world, but there are ways to end the devastation. We must be part of the larger community of those dedicated to bringing social justice to Colorado Springs, and to Denver, and to Mississippi, and Missouri, and Thailand, and Botswana. And we must stand for no less than a society and a world where sexual integrity is possible for all. Blessed be.